question? Right, so if you have read and understood considering its surgical pathology station, kindly tell me what are the differential or the provisional diagnosis that comes
So
in your
my
mind?
provisional diagnosis is pulmonary TB, and the
Yes,
differentials can be lung cancer, can be esophageal varices, and can be maybe lymphoma.
Very good. Okay. How would you differentiate between tuberculosis, lung tuberculosis, and lymphoma?
Okay, so we have to check the sign symptom. Of course,
Yes,
here is like
yes.
productive cough, then night sweat,
Yes,
and
very
fatigue
good.
is
Very
a
good.
difference from lymphoma, but otherwise like weight loss and those fatigue.
Just suppose if
These
it's lung tuberculosis, what investigations would you ask for to confirm your
okay, so
diagnosis?
for lung tuberculosis, we can do the immediate test, MRCS test, and we can take the sputum for cytology, microbiology, and culture. So we can do chest X-ray, and if there is any lymph node, we can do a lymph node FNSC or biopsy, and we can do even PCR and quantiferon.
What is one test which can be done for the rapid detection of mycobacterium?
So for one test, I will go for PCR, polymerase chain reaction.
Okay. Can you tell me, right, how would you describe the word granuloma?
So granuloma is a chronic inflammatory condition where we can found some giant cell and caseous necrosis.
What are the different types of granulomas that you are aware of?
So it can be inflammatory granuloma, it can be malignant granuloma, then it's TB granuloma.
So could be because of infection, inflammation,
Yes.
and foreign body. And one
Yes,
of them in which it's infection is tuberculosis.
Yeah,
Right.
infection is tuberculosis, inflammatory can be sarcoidosis, and foreign body may be like stitch or any other foreign body.
So how the Montauk's test is done or carried out?
So Montauk's test, we have to inject a patient, like it's called interlipid, I think. So then we have to mark around intradermal, and
Yes, yes.
yes, then we have to mark around the injection, and then we have to wait for maybe 1 hour to see if the circle is increased, then it will be positive.
You have to, all right, okay, we'll discuss that later. Can you tell me how long the culture media for mycobacteria takes?
It can take 6 to 8 weeks.
4 to 6 weeks, yes.
Mm.
Okay. Other than mycobacterium, what are the other mycobacterias that you can or you
Okay,
are
so is
aware
the
of?
Mycobacterium bovis, Mycobacterium avium intracellulare, Mycobacterium kansasi.
Yeah.
Mm.
Okay. Right.
Then,
Can you tell me why knowing or confirming tuberculosis could be a public health concern?
So as is highly infectious, is uh, uh, is is spreaded by the cough and sneezing. So uh, it can be a
All right,
public health.
we'll come back
public
to
health.
this later.
Yeah.
How would you differentiate it from lymphoma? If it was lymphoma, then what are the most common lymphoma type that can or that could occur in this particular?
Okay, so at this age, maybe is a non-Hodgkin lymphoma.
Very good.
So if we do biopsy,
Yes.
then the giant cell will be different.
Yes.
For lymphoma, we can found a Reed Steinberg giant cell, and in TB we might get a Langerhans giant cell.
Good. Okay. Once you have established your diagnosis that it is tuberculosis, can you please tell me what pathogenesis occurs in tuberculosis?
So is Mycobacterium tuberculosis.
Yes, but can you tell me? If you can look at this image and describe, please, what do you see?
Okay. So this one looks like is a histiocyte and Langerhans giant cell.
Yes.
And
Clusters of, yes.
yeah,
Langerhans cell.
clusters of epithelial cell.
Yes. And how
And
would you
maybe
describe what kind of stain it is? What about the nuclei? Describe,
okay.
please, in few words, please.
Okay. So maybe it's a Jail Nelson stain.
Very good, Zell-Nelson stain. And what about the nuclei? They're multinucleated?
Is a multinucleated giant cell
Yes.
is there.
Yes. And anything else? You see different levels of stains on the cells? Some are more coarse, some are less.
Yes.
All right, good. Okay, can you please tell me? Told me all the investigations and what more I had to ask you. That right. How would you just you have confirmed your diagnosis and it happens to be tuberculosis of lung? How would you treat the patient?
Okay, so we have to isolate the patient. We have
Yes.
to start DOTS, direct treatment in short course, direct observation treatment in short course.
Yes.
Then we have to consider like initial phase and continuation phase. Should I talk about the medication?
Medication, yes, please.
Okay,
Because
ma'am.
if
So we can initial phase we can start with either rifampicin, isoniazid, ethambutol, and pyrazinamide. And for continuation phase, we can go for rifampicin and isoniazid only.
all right, just
So
suppose.
initial phase is for 2 months,
Okay.
and 4 months for continuation phase.
Just suppose you've given the medication to the patient and this is the image that you've taken after 2 months. What do you see in the image? What kind of image is it?
Okay, so is a plain X-ray of chest,
All right.
which shows some consolidation on the mostly on the left side, upper lobe,
Yes.
and some patchy opacification in both lung field.
Okay. So you interpret it as that medication is not being effective. Its patient is non-responsive to the medications. How would you confirm that patient is actually taking medications?
Mm. Okay, I'll come back later.
Okay. Right. So time has gone. Thank you.